Now we will have a discussion on what are called end-of-life initiatives. What people mean by this is that when someone gets older, they should have a discussion on what kind of care they want to receive when getting to the end of their life. For example, if you were to get cancer and you were told you were in your last days or weeks, you may want to choose to not continue taking a lot of drugs or chemotherapy because it will not save your life. These are the types of discussions that you can have with your doctor that could be put in your medical record so they know what you want in advance. Some opponents of healthcare reform have referred to these discussions as death panels, claiming that care would be denied to elderly people and that medical boards would decide who lives and dies. Do you think that end-of-life initiatives should be part of healthcare reform?
Yes, everybody, everybody's gonna die, but it's just a matter of how you want to go out. And I think they should just not have it like that's the right answer. Like that's the final one you're gonna choose. I mean, it's different when you say it and then you're in the situation, then you're gonna want to change it or something.
And it could be a broad, picture of what you want. So you could be specific later on when you're getting closer and closer.
Yeah.
And then also that with the end of life initiatives that you could tell them really what you want exactly. And it really thinks if you want to go out weak and with all the drugs or go out bright and big without having all these drugs and spend time with your family instead of in the hospital.
Yeah, it's just some people don't want to think about death or even talk about it, but it's life. We're born, we live, and then we die. And it's just up to your religion what's after death for you. But honestly, I want to go, like, I would want to go knowing that I tried, but, then I want to be, strong in the end when I pass away. That's what I would.
Okay, let's get a little more specific as to what your personal health care directives would be in an end-of-life discussion with your doctor. In these examples, you are being asked what your instructions should be prior to the event taking place. Example 1. You are diagnosed with an incurable cancer that has a 99% death rate. You are currently taking a lot of drugs and chemotherapy. What would be your directives to your doctor?
Well, you still got that 1%, and me personally, I would want to fight for it, but if I knew that, like, I would fight for it and take the chemotherapy and all that stuff, and I would ask the doctor to, like, count my cancer cells every day, and they don't see anything, like, in 2 months, well, then I'll just live the rest of my life, knowing that I did try, but it wouldn't help whatsoever. I would want to be with my family for the days I do have on Earth.
And I would just go for a couple of weeks with the chemotherapy, and if it doesn't work, then just let me go.
I'd be like, I'd rather go out knowing that I tried in the end, but it didn't work. I would just like have the rest of my days with my family.
Just to be with them until it's time to go.
Yeah, I would want to die at home, not in a hospital with like all these wires on me.
And all the people you don't know.
Yeah, you'd be like, who's that?
The last person you ever see is a nurse.
A nurse would be like, oh, great.
Example 2. You are in a bad car accident, are in a coma, and have brain damage. You are being kept alive by a machine. What would your directives be?
I wouldn't, just to keep me on for like 1 or 2 days, and like they don't see anything. If you're brain damaged, well, that's it. You can't come back whatsoever. So I would like want them to take me off, and like I wouldn't want machines help me to live. I want to live on my own and stuff.
You don't want to be hooked up, not able to do nothing.
Yeah.
What is it?
It's not
be a
life.
vegetable.
Yeah, it's not life at all. I'd rather, if that's the expense of just being hooked up to a machine, I wouldn't want that to be put on my family.
And then also your funeral cost plus that, it wouldn't be right.
Yeah, your family would be pretty much in debt for their life, and it's not right whatsoever.
And if I was that, I just bye-bye for me.
Yeah.
Example 3. You have heart disease, have a heart attack, and die. Typically, in this situation, you have 7 minutes before brain damage sets in. Do you want to be resuscitated?
Probably like 1 or 2 times. Well, because you have it the first time, and they bring you back, okay, and you get those extra days, and then you do it a second time. I guess I would want to be brought back, but then I guess I should get the hint from the big guy upstairs. If he gives you a heart attack the second time, it's like it's your time already. So, but
One way or another.
yeah, it's like you can't really go around it, and it just I wouldn't want to experience death over and over again.
And then I guess I want to be revived once. Once to see my family and say goodbye to them because you know it's going to happen again. And then just tell them not to shock me.
Yeah. To have that closure, just saying what you need to say, and the second time comes around, it's whatever.
They already know, they already have a heads up, and they won't feel as bad as the first time.